Governor Abbott says the negatives from another statewide shutdown outweigh the positives, so he is not going to do it. Hello, everybody. I'm Heather Hayes.
And I'm Steve Eager. The governor says COVID-19 patient treatment and testing is getting better, and enforcement of current public health measures is what's actually needed.
Daily virus patient hospitalizations, a priority metric for the governor, remain high, even though the percentage dipped a little today to 13.2% after reaching nearly 14% yesterday. Tarrant County's number fell from yesterday's pandemic high.
Of the four most populous counties, Dallas was the only one with an increase in patients since yesterday. Fox 4's David Santendry has more from the governor and concern from area leaders, too. David.
Well, Steve and Heather, the governor is calling on local agencies to better enforce measures that could help prevent the spread of COVID-19. But some of those local agencies say when it comes down to it, the governor is really not giving them the power to do so. Deep Ellum's The Point Skate Shop says it's been thriving as people look for hobbies that allow them to stay outside during the pandemic.
It's much like bicycles, rollerblades, roller skates.
But with COVID-19 cases and hospitalizations on the rise, the future's unclear for business owners.
So I know that the government has said, at least Abbott has said one thing, and then I know that we've had Jenkins say other things here in the past. So I'm just kind of waiting to see.
Well, Governor Greg Abbott publicly answered questions from the media for the first time in weeks Thursday.
Statewide, we're not going to have another shutdown.
The governor adds local agencies can better enforce pandemic safety measures.
There are plenty of tools in the toolboxes of local authorities to achieve the results that are needed. And they need to be enforcing the protocols that are in place right now.
The Dallas and Tarrant County judges have said they want the governor to issue more public health measures or give them the flexibility to do so. And the Tarrant County judge says strong enforcement of the governor's orders, like the mask mandate, isn't that simple.
Our DA and their associations, sheriff and their associations, and the police and their associations all say that the way they wrote the order, I think it was 28 or 29, that says you cannot detain, prevents them from being able to write citations to individuals.
Tarrant County Judge Glenn Whitley says he'd consider a curfew for bars, restaurants, and more, but the governor's order does not grant county judges that authority.
I would like to see authority given back to the county judge.
The regional hospitalization rate for 19 area counties has been rising for a month, and although there was a slight decrease Thursday, experts believe the worst might be around the corner.
This is some of the highest we've run.
DFW Hospital Council CEO Steve Love says it's now seeing increased hospitalizations in rural areas.
It is more of a rural spread, even in Hunt County, Wise County. We're getting more and more COVID hospitalizations.
13.2% of regional hospitalizations are COVID-19 patients. If that percentage goes above 15% for 1 week straight, the governor's order will close bars and reduce capacity in some other businesses. Regions like Amarillo, Lubbock, and El Paso already met that threshold, but again, no statewide shutdown.
Shutdowns will not lead to the positive results that some people think. One of the most common ways that COVID is spread today is not by someone going to work, but by people gathering together in home settings or in casual settings.
Businesses like The Point continue to do what they can to stay safe while staying open.
Everybody has proper masks, everybody has proper PPE, and everything's been sanitized for each person as they come and go. A number of regional hospitals have already activated surge plans, but the DFW Hospital Council says its biggest, most pressing issue right now is just for these hospital workers, the manpower. They say a lot of these employees have been working double shifts, they are tired, they are overworked, and it's been like this for quite some time right now.